Hello, and welcome to Beaumont. If you're watching this, you've probably been diagnosed with a kidney stone, and that can be quite painful. Our goal is to help you understand how the stone and pain will be managed. The kidneys are a pair of organs, each about the size of your fist. Their primary job is to remove waste from your blood. And as the kidneys filter blood, they create urine that drains down the tubes called ureters that connect to your bladder. Kidney stones form when waste crystals separate from the urine and become stones. These pass from the kidneys down the ureters, and they can block urine flow, causing pain.
Kidney stones have a few different types of symptoms. Most commonly would be what we call flank pain, which is pain kind of deep in your back, because that's where the kidneys live on either side. And they would often have either a pain, maybe a sharp pain, or it could be a deep, dull ache. Also, commonly, patients will have blood in their urine if they have kidney stones.
The biggest problem we have in our population is not drinking enough water. Patients who are kidney stone formers tend to be a bit dehydrated. There are many factors. There are dietary factors, again, not drinking enough water. Sometimes patients can have metabolic abnormalities where they put out too much substances in their urine, such as calcium. That's part of the beauty of kidney stone disease is not only do you treat patients surgically, but then you can evaluate them medically to try and figure out why they form stones. There are some patients who drink gallons of milk a day and they put out a large amount of calcium just because of the amount that they consume. But most people who put out too much calcium do it because of a leak from their kidneys. Where the calcium, the body's ability to retain or to hold on to calcium is compromised, and they leak calcium into their urine and can be stone formers.
Once you've had a kidney stone, you're at increased risk for forming more. That means you should schedule regular kidney imaging tests like CAT scan or ultrasound. You can also reduce your risk of kidney stones by watching your diet. Drink enough liquids, especially water, each day. At least half of your liquid should be water, and be sure to increase the amount you drink when exercising or the weather is hot. Reduce the amount of animal protein and salt you consume. Eat fewer foods rich in oxalate. That means limiting nuts, chocolate, coffee, green leafy vegetables, beets, and sweet potatoes.
So what's going to happen to you if you do have a stone? Well, if you're having this kind of pain, the first stop is going to be the emergency room, where they will likely do a CT scan to see what is the cause of your pain. And this is an excellent way to diagnose the presence of a kidney stone that is blocking the kidney or a stone in the ureter tube. If it looks like you have a small kidney stone that's stuck in the ureter tube, then you may be given medications to help you pass it if indeed it's small enough. On the other hand, if the stone is too large, you may well be admitted to the urology service at the University of California, Irvine Douglas Hospital, and their treatment for this stone would be undertaken. Fortunately, the treatments at UC Irvine for kidney stones no longer involve open surgery. What if you have a giant kidney stone? These stones can be as large as literally a tennis ball. When these stones affect the kidney, you run the risk of actually kidney damage as well as kidney infection. The entire white area of this slide is a kidney stone. However, today, with regard to our techniques, we can remove that stone entirely through a hole in the back no larger than the tip of your finger. By removing the stone entirely, we can preserve the function of the kidney, and if we're able to remove all the pieces of the stone, we can help prevent it from recurring.
Stand onto your knees and widen your legs really nice. Bring your palms facing down, your fingers facing down onto the back of your hip, and slowly inhale first and exhale slowly. Push your hips forward and slowly bringing your arms to your ankles and arch back.
move the palms just beneath the shoulders. Inhale, head up, elbows straight, feet together. Exhale, down.
From here, inhale, lift both your legs up and roll your elbows inwards. So your shoulders are rolled back and your elbows are inside. And now bring your hips straight. And your legs are straight. Gaze at your toes.
Now gently take both the knees towards your chest. Interlock your hands. If you want more squeezing of your abdomen, you can hold both the sides of your elbow. Pull the navel inside as you exhale. Try taking the chin towards the knee. Don't take your forehead to the knee, then you'll be hurting your neck.